16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Good evening. Welcome to a brand new episode of BMC Global Live, Hilal HealthWorld, Nothing But Lifestyle. I am Jessila Mujib. In this talk show, we bring before you an expert doctor from Hilal Hospital to discuss your various health issues. Today the topic of discussion is ovarian cyst. We have with us Dr. Brahma Lakshmy from Hilal Hospital, Muharraq. She is a laparoscopic surgeon specialized in obstetrics and gynecology with an experience of 9 years. To discuss the topic in detail, let's welcome Doctor to the show. Hello Doctor, welcome to the show.
Thank you.
And thank you for being with us to discuss this topic, ovarian cyst. So Doctor, what is ovarian cyst and how often do you come across this condition in your OP?
Ovarian cysts are basically fluid-filled structures which arise from the ovary. It can be seen within the ovary or on top of the ovary. Sometimes even next to the ovary. We call them para-ovarian cysts or paratubal cysts. Though we call them ovarian cysts as a general term, there can be ovarian masses which are solid also, or which contain hair, teeth, skin, other glands, tissues, yes. So, as a general term, we do call them ovarian cysts, but there are ovarian masses which are not cystic as well.
So, they are fluid filled also and
sometimes solid, sometimes containing other tissues as well. We call them dermoid cysts. Some might be blood filled, we call them endometriotic cysts. So, there are different varieties, yes.
Okay. Doctor, around what age are women prone to this ovarian cyst?
What we see in our OPD is that most of the patients who come to us are of the reproductive age group, that is from menarche to menopause, around 14 to 50 years of age. But then we have seen ovarian cysts in newborns when they were in their mom's tummy itself, they were born with ovarian cysts, which one of them we had to operate, one resolved by itself. So even that is possible. Even when they are born, they can be born with ovarian cysts. And of course, postmenopausal ovarian cysts are also seen, which we consider more dangerous, because once you reach menopause and then you start developing ovarian cysts, the chances of them being malignant or cancerous is more. So the age group, more commonly definitely in the reproductive age group. But then we do see them when they are born, we do see them in the postmenopausal age group as well. But the younger they are, the chance of cancer is more. At the same time, the older they are, the chance of cancer is more.
Okay. So mostly found in the reproductive age of
age group.
Group. Okay, doctor. I want to know the symptoms of ovarian cyst.
Interestingly, most of the patients who come to us, they come with an ultrasound report.
Okay.
So most of the ultrasound reports showing ovarian cysts. So it is an incidental finding in about 50% of patients who come to our OPD. They don't come with a symptom. Well, if you consider symptoms per se, the most common symptoms they come with, and then we find an ovarian cyst, is when some people have pain or dull aching sensation or some kind of bloating sensation, is what they generally complain of, like pain, bloating sensation, like that. Some patients come with a little bit of menstrual irregularity, and some patients come with severe pain. Severe pain is mostly because of some complication because of an ovarian cyst, like torsion, hemorrhage.
So mostly no symptoms will be present.
No symptoms, and even if there are symptoms, especially for cancerous ovarian cyst, even if there are symptoms, they are usually very vague. They just have bloating sensation, they are not able to digest food, or they have constipation or something of that sort, very vague symptoms.
So I have read that there are different types of ovarian cysts.
Yes, so, of course. Ovarian cysts are of so many varieties that talking about it would be a half an hour class by itself. But then generally, what we see very commonly are functional ovarian cysts. See, when we say ovarian cyst, we consider a size, because ovaries develop follicles every month. The follicles grow, then they rupture, we ovulate. So when the follicles grow itself, the follicles come to a size of around 2.5 to 2.8 centimeters sometimes. So that 2.8 centimeter cystic structure, which has fluid in it, when we see it, we shouldn't diagnose it as ovarian cyst. It might be just a follicle which is going to rupture. And even after ovulation, the remnant of that follicular cyst or the follicle, it develops into something called a corpus luteum. That is again a cystic structure, a fluid-filled structure, which can be again 2.5, 2.8 centimeters. So anything less than 3 centimeters, a fluid-filled structure that we see in the ovary, we don't tell or we don't diagnose them to be ovarian cysts. Even if we tell them they are functional cysts. That is, during the process of ovulation or during the reproductive age group, whatever hormonal changes happen, because of those hormonal changes, we develop small structures, small fluid-filled structures, which we don't diagnose as ovarian cysts. Those are the most common findings in ultrasound, which the patients come with, where actually they don't have any symptoms, but then because they have written a cystic structure there, they think that, okay, I have an ovarian cyst, what should I do about it? Those are the most common ones. Then some patients come with some vague pain symptoms. Such patients, when we look at them, these functional cysts might have some amount of bleeding into it. We call them hemorrhagic cysts. So hemorrhage into the cyst causes a little bit of pain.
Internal bleeding?
Internal bleeding. Bleeding as in not into the abdomen, but into the cyst itself. Okay. So such cysts can cause pain, because of which the patients might come to us. Then there are very clear ovarian cysts, which like I said, if it's less than 3 centimeters, we don't call them ovarian cysts at all. More than 3 centimeters, 3 to 5 centimeters, moderate size cysts, very clear cysts, fluid filled. They are, like I said, benign as in not cancerous ones. 3 to 5 centimeter cysts again are something that is commonly seen in the reproductive age group. When it goes beyond 7 centimeters, that is when we think of other possibilities. So yeah, the simple ovarian cysts, that is what we call them. Then there are endometriotic cysts. Some patients have a disease called endometriosis where they have endometrial tissue outside. Endometrium is the lining inside the uterus actually, which bleeds every month. But then they have these tissue on the ovaries, outside the uterus, in the abdominal cavity. So more commonly it is on the ovary, where they bleed every month like what we bleed outside. But then they become cysts, which are called endometriomas. Okay, that is another type of cyst. Then ovarian cysts are like simple endometriomas, dermoid cysts, like I was telling you about. Dermoid cysts are cysts which have sometimes hair, teeth, sebaceous material, glands, lots of things. They are actually those germ cells, we call them, as in the cells from which the ovary was formed, which have the potency to become anything, any part of our body. It's that one cell which can become any part of the body. So then it sits and grows, and when you reach about your 20s, late 20s, early 20s even, we have patients coming with dermoid cysts. Then of course the malignant variety or the cancerous ones, which have which are like what do you call, they have more solid component. Sometimes we might see that there is fluid inside the abdomen. We call them ascites because of the malignancy, because of the cancer. They might have already spread to other organs, because of which they might have other symptoms other than the cyst per se. So different varieties.
Different types.
Yes, and even fluid-filled structures near to the ovary sometimes might be diagnosed as ovarian cyst, which we end up finding out later on when we do a higher investigation like an MRI or a CT, where we find that it's not actually from the ovary that cyst has developed. It might be a peritoneal inclusion cyst, there are paratubal cysts, lots of fluid-filled structures which can develop in any person. So that can be confused with an ovarian cyst also.
So do you describe in detail about different types of ovarian cysts? How do you diagnose ovarian cysts? What are the tests to be done?
Yeah, like I said, ovarian cysts are usually diagnosed by the time they reach a gynecologist, because ultrasound is something, an investigation modality that anybody is using, a physician or a surgeon or anybody. When any lady walks into the OPD with some kind of vague symptoms within her tummy, the first thing they would think of is doing an ultrasound, find out what's happening inside. So they end up finding out that there's an ovarian cyst, and they come with an ultrasound report saying that okay, there is a this much centimeter size ovarian cyst. That is the most common investigation that we tell them to do as well. As in, when somebody comes to us with the same kind of vague symptoms or pain or abnormal bleeding, anything of that sort, we again the first investigation modality would be an ultrasound. When we do an ultrasound, we see the ovarian cyst. Once we see that it is it is of a particular size, as in, like I said, 3 to 5 centimeters, more than 5 centimeters, more than 7 centimeters. So according to the size, according to the character of the cyst that is seen in the ultrasound, that it is just a clear fluid-filled cyst which is only 3 to 4 centimeters, we don't do much about it, because up to 5 centimeters we can leave them alone. Next step, if it's bigger and it has some solid components, there is some fluid within the abdomen, there is some suspicion, maybe there is chance of cancer, then we end up doing something called tumor markers. There are blood tests which can tell us if the ovarian cyst is cancerous. So those are the blood tests we go ahead with. If we see that they are high, then the next step would be doing a higher investigation, as in doing a contrast CT or a contrast MRI. Mostly we'd go ahead and do a contrast MRI, where we can see the structure of the ovary properly, of the cyst properly, and there are certain pointers which will tell us maybe it is malignant, maybe it is cancerous. So, and also it will tell us about the spread, how far it has spread, all those things. All the more detailed investigation is an MRI, especially a contrast MRI. So those are the tests which we do by step, and it depends on the size and the character of the ovarian cyst that we see in the ultrasound. So the basic first line definitely is an ultrasound.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Any specific causes for the ovarian cyst, like a family history, something like that?
Ovarian cyst, actually per se, we haven't found a cause for an ovarian cyst. It would have been nice if we could find a cause for ovarian cyst, because we could tell everybody, okay, you're not supposed to do this, you'll end up having an ovarian cyst. But then it's been, lots of theories are there. It is seen that ovarian cysts are more commonly seen in women who have less number of children.
How is it?
Okay, as in they have more ovulation over a period of time. Early menarche, they have menarche at 9 years, 10 years, late menopause. So that means they have a long period of time through which they are ovulating. So every time they ovulate, there is a rupture on the ovary which has to heal, which was said to cause ovarian cysts later on. But then later on, it was also found that it is not the dangerous malignant ovarian cancers which were found, the easily spreading ones. It was found that it arises from the fallopian tube and not the ovary. We have uterus, the fallopian tube and the ovary. So the end of the fallopian tube, those cells are which causes cancerous cells, is what we found out later on. Some theories suggest that. Some people, and interestingly, people who use contraceptive pills prevent ovulation. So those people are less prone to have ovarian cancer, is what's seen. So again, the more you ovulate, the more you have chances of having an ovarian cyst, is what, or ovarian malignancy is what is said. So yeah, that is how the cause per se is said.
And family history plays a role?
Family history, yes. Thing is, for malignancies, for cancerous ovarian cysts, not just ovarian cysts, there are some cancers which run in family. Some people who have BRCA, BRCA gene, like you would have heard of Angelina Jolie, where she removed her breast because she has the gene from her mom. So those genes, though there are some genetic disorders which can be transmitted over generations, and they are prone to have cancers, not just ovarian cancer, breast cancer, endometrial cancer, even bowel, stomach or colon cancers. So those are the ones which run in families. It's not ovarian cysts per se, they're the chances of malignancy, chance of cancer that runs through the families.
Okay. Doctor, can you explain the complications of ovarian cysts?
Complications, like I said, it's usually patients come to us in the OPD with a symptom of the complication. That is, when there is hemorrhage into the cyst, when there's bleeding into the cyst, they come to us with pain. When there is torsion, there is something called the ovarian cyst. When it's a moderate sized ovarian cyst, it can turn on itself, gets twisted on its pedicle, and the blood flow to the ovarian cyst is stopped, because of which the patient will have pain. So that is one of the complications that can happen. Another complication that can happen is this hemorrhagic cyst might just rupture. Again, severe pain, and most of them, the pain subsides once the rupture happens. Only when during the rupture there will be pain, after that there won't be any pain. So that is another complication. Ovarian cysts which are benign per se, which are not malignant per se, them turning into cancer is very, very rare. We have seen that 1%, less than 1% of endometriomas, like I said, endometriomas, they can turn into malignancy later on. But otherwise, when ovarian cysts are formed, it is formed either as a benign, non-cancerous one, or they are formed as a cancerous one. So it is not like benign one turns into malignancy. That is very, very rare.
So it's a common doubt that a woman with this ovarian cyst can get pregnant, and will the ovarian cyst causes infertility in women?
Ovarian cyst per se doesn't cause infertility. It doesn't prevent a person from having babies. The only thing is there are some ovarian cysts, like I said again, endometriosis. Endometriosis is a disease which causes infertility, which causes patients to have difficulty in having a baby, conceiving a baby. So of course, that endometrioma is something that can cause an infertility.
Doctor, you told about the polycystic ovary now. Can you explain it in detail?
Polycystic ovarian syndrome. Again, lots of patients come to our OPD with a big, huge confusion. They tell us that they have ovarian cysts, and then when we look at their ultrasound, what we find is polycystic ovarian syndrome. So the difference is, polycystic ovarian syndrome doesn't mean that the ovary has cysts in them. Polycystic ovarian syndrome, or polycystic ovaries, just means that there are so many follicles stuck in the ovary which did not ovulate. Okay, like I said, the follicles can grow up to a size of 16 millimeters, 20 millimeters and get stuck there. It won't ovulate. And because of not ovulating, those women don't have periods regularly. So without ovulation, there is no regular periods. And because the eggs are not coming out, the ovulation is not happening, the follicles are seen in the ovary itself. And it looks like as if there are so many small cysts in the ovary. So polycystic, so many cystic structures within the ovary. That is all that it says. They are not cysts, and they don't need any treatment other than for infertility.
You already mentioned about the cyst turning malignant. Can you describe it in a little bit detail?
It turning into malignancy is very rare, but when we see that there is an ovarian cyst in a very young girl, especially if, like I said, ovarian cysts, though we call them ovarian cysts every time, they might not be cystic in structure. They might be a little solid, which will tell you that maybe it is cancerous. So in a young girl with a solid ovarian tumor, which doesn't look very only cystic, maybe it has other associated features along with it, and pre-menarche, before menarche, or even during that perimenarche age, when we see an ovarian cyst, chance of malignancy is more in them. That is one thing. Again, the other extreme of age, above 50 years. Menopause, once they have reached menopause, usually we are not ovulating anymore, right? So this cystic structure shouldn't be forming because of our hormones not being there. And they come with ovarian cysts. That is when we have to be a little careful. Okay, again, maybe they are malignant, maybe they are cancerous ovarian cysts. But then again, if they are very small, like I said, around 3 centimeters or 4 centimeters only, and they are clear, they don't have any other features which tell us maybe they are malignant, then we can wait and watch. We don't have to do much about it. But when we see that there are features suggesting maybe they are cancerous, we go ahead and do the blood test, MRI, and the further steps out.
Now that you have described it in detail, now what are the treatment options? Can we go without surgery?
This is another big misconception. Like everybody who comes to OPD with an ovarian cyst seen in the ultrasound, they're all like, when do I do the surgery? When do I have to do the surgery? Is this cancer? See, like I said, 90-95% of these ovarian cysts which happen in the reproductive age group, they're not malignant and they are functional. That is, along with the hormonal changes that happen with every cycle as we ovulate, it forms fluid-filled structures which vanish, which disappear in 2 or 3 cycles. So if we do an ultrasound maybe after 3 months or 4 months, the same cyst which was seen, 3 centimeter, 4 centimeter, 5 centimeter, it won't be there anymore. It will just get absorbed and it vanishes basically. So first of all, surgery is never the first option, never. So the common cysts which are seen are usually less than 5 centimeters, maybe 5 centimeters, that's it. All those cysts we can wait and watch. We can repeat the ultrasound again after 3 months, see if they are growing. If they are growing, definitely yes, we go to the next step of investigations, do blood tests, do MRI, all those things. But otherwise, those cysts are just left alone, can be left alone. Then there are certain types of cysts which are like if they cross 7 centimeters. Then again, the size, it's huge. Because of the size, there can be complications. Like I said, 5 to 7 centimeter cysts are cysts which can undergo torsion, which can have hemorrhage and cause severe pain for the patient. So because of the size, just because of size, not because it is proven to be malignant, we might have to remove it, or because of one of these complications, because it might rupture and the bleeding might not stop, or there's torsion, which again needs surgery. Then there are cysts which over a period of time we are seeing it's remaining same. 3 centimeter, 3 to 4 centimeter, it's remaining the same. Oh, after 6 months also, after 1 year also, then just leave it alone. It is not going to turn into malignancy later on. They are stable cysts which are there, fluid filled structures which are there, let it be, it's okay. Then there are some which require treatment other than the complications that happen. One is this endometrioma. They are patients who come to us with infertility, because endometriosis per se causes infertility. So we might have to remove the cyst, treat them for the infertility and let them conceive. So that is where surgical option comes in. Then other than the size being big, there are certain features in the ultrasound and later on in the MRI and in the blood test which will suggest maybe it is malignant, maybe it is cancerous. That is when we definitely go ahead and do a surgery. So treatment options definitely depends on the type of cyst, whether it's a very clear, very benign looking cyst, because of the size of the cyst. If it's huge, then we tend to remove it, and whether there is any malignant change or not, or whether if there is some complications. So everything has to be taken into consideration, plus of course the age of the patient. They are in the reproductive age group, 3 to 5 centimeter cyst, we don't do anything. But when it's a young girl, very young girl, like I said, pre-puberty age group, 3 to 5 centimeter, if it's looking even a little on the solid side, we go ahead and do a surgery and make sure it is not cancer. Yes. So treatment options vary, but surgery is definitely not the first step. And some of these cysts, endometriosis, even endometriosis, if they are small, there are medical management for endometriosis. There are medicines, tablets which can be given to make the endometrioma subside. And there are injections also, like non-surgical methods, either tablets or injections which can be given, which will decrease the size of the cyst and cause the symptoms to be relieved. Basically they come with pain, dysmenorrhea during periods. That is what they complain of basically. So that comes down with tablets and injections. So yeah, treatment options are varied. But then when it comes to surgery, what I was thinking was when this topic came up, we just did a laparoscopic ovarian cystectomy for 2 patients, 2 different variety of patient actually. When I went through those 2 case histories, it was very interesting that one lady, she is Paris, she has 3 to 4 children. She is around going to be 40, in the late 30s. She kept complaining of lower abdominal pain, which was not evaluated by an ultrasound for a very long time, because she said gas, abdominal distension, so she was given anti-gastritic medications, all that. Later on, somebody did an ultrasound and found that she has a huge 8 to 9 centimeter ovarian cyst sitting there, which is causing all these symptoms. So there, the treatment option, definitely the first step, causing the minimum trauma possible to the patient. Even though she has kids, the thing is to retain the ovaries, to keep the ovaries there. So we went ahead and did a laparoscopic surgery. That is a keyhole surgery where we put in a camera, look at the cyst, remove the cyst, but remove the cyst in piecemeal so that we don't damage the ovaries and take it out. Another girl who was not married yet, she was 26, 27 years. She had again same symptoms, pain, but she came to us early enough, I guess, because for her the symptoms started only very recently. So she came to us as soon as she got her symptoms. And when we saw again the same size, around 8 to 9 centimeter, big huge cyst, but that was a dermoid cyst. Dermoid cyst means, like I said, it has hair, tooth, sebum, everything in it. So she doesn't have kids. So definitely the first priority was to retain the ovary, make sure that I don't damage her ovaries. So we did a laparoscopic procedure again. We removed the dermoid cyst and she went home with both her ovaries intact. So laparoscopy is something that is very useful when it comes to ovarian cyst. Even if it's a complicated, one of those were actually twisted, that is why she had pain. But it was not twisted so much that the blood flows damaged, but we could retwist it, untwist it, and untwist it and get the blood flow back, so the ovary could be retained. So interesting things happen
Yeah,
when
that's
it
very
comes to
interesting.
laparoscopic. Laparoscopy is something that has been given to us to manage such cases. But there are cases when we have to go ahead and open the patient sometimes. Even like endometriomas or any kind of ovarian cysts can be managed laparoscopically. But then there are some situations when they're really huge. We have had huge ovarian cysts which look like term uterus, like 9 months uterus, that big.
What
huge.
size maybe?
No, when we measure it, it's like 36 centimeters. So we can't take out such cysts per se, like we don't open from top to bottom, but still we might have to go abdominally. We can't put in a port, put in a camera and all that and do remove
You
such
went for
huge
open
cysts.
surgery?
Open surgery, yes.
Okay.
And some came with complication, as in hemorrhage already bleeding inside with blood inside or the fluid inside, in which cases sometimes it's difficult to go in laparoscopically. We might have to open and go ahead with the surgery. Then there are cancerous ovarian cysts, which nowadays we do laparoscopy for them as well. In an expert hand, oncosurgeon who is well trained in laparoscopic procedures for cancers, they can go ahead and do a laparoscopic procedure. But then otherwise, usually the tendency is to open them so that we clear the field properly, as in we need to take out as much of the tumor as possible so that they survive longer and they don't have to take so much of chemotherapy to kill all the rest of the cancer cells that we would have left behind. So cancer, yes, maybe more of an open surgery thing, but most of the benign tumors, ovarian tumors, can be dealt with laparoscopically, which is keyhole surgery. The patient can go back home right after the procedure, maybe the next day itself or that day itself, depending on the condition of the patient, the rest of the vitals of the patient. Yeah, so treatment options when it comes to surgery, of course, laparoscopy is first option, but there are situations where we might have to open them as well. Sometimes we might go in laparoscopically, but then we end up having to open the patient because there are lots of adhesions, everything, bowel, uterus, everything is stuck to each other and we're not able to get a good plane. But that is very rare. Nowadays, people who are doing laparoscopy regularly, usually that doesn't happen. We will be able to clear them with the laparoscopy procedure itself.
Okay, Doctor. Doctor, any advice from your side for our viewers on your topic or any related topic?
See, ovarian cysts, the only thing I need to tell anybody and everybody who comes panicky, they come into the OPD saying, oh, so madam, I have an ovarian cyst, I think I need surgery. That's the first thing they say. And then I'm like, sit down, let's see what it is first. And a very small ovarian cyst, which is just causing pain because of little bit of hemorrhage or little bit of bleeding into the cyst, don't try and make the surgeon or make the gynecologist do a surgery on you. You don't need a surgery. Wait, the pain will subside by itself maybe over a period of time, 5 to 6 days, within a week. After that, after you start ovulating again, another 2 cycles, when you do the ultrasound, that won't be seen at all. So a surgery that would have been done would be unnecessary. But like I said, there are situations when the hemorrhage, when the bleeding into the cyst is so much that it might rupture and cause bleeding within as well, where we might have to go and do an emergency surgery. That is also there. So it depends. But then don't think that any ovarian cyst, especially if you are in the reproductive age group, don't think that all of them are malignancy, all of them are cancerous. When you see cyst, when you see ovarian tumor, that doesn't mean that it is cancer. Let us find out whether it's cancer, then see. So it is not that something that needs an emergency surgery operation at that point of time. So don't get so panicky, because like I said, 90% of them are benign. It's a very, very small number. Over a period of time, if you check, any woman has a chance of 20% chance of having an ovarian cyst during their life. So that much of chance is there that you will be found having an ovarian cyst if you do an ultrasound incidentally. So what is there? That might have gone unnoticed if you never did an ultrasound. So don't panic when you just see an ovarian cyst, especially if it's small. They just say that it's a hemorrhagic ovarian cyst, something of that sort. But then there are some patients who sit on it, like one of my patients. She sat on it for about an year. She had pain, she had pain, she had pain. She went to different places, never did an ultrasound, and ended up having a huge ovarian cyst, which luckily we could take it out laparoscopically itself, but still maybe she could have been diagnosed a little earlier. Not that she developed cancer, but still she didn't have to go through that pain all those months. So that's it. Basically, not most of the ovarian cysts are not cancerous unless you're postmenopausal and you have a huge ovarian cyst, or you're very young and you have an ovarian cyst. So there's no need to panic. Just that get diagnosed, getting treated at the right time is the only thing that needs to be done. So there are people like me who can do that. So you just visit us.
So thank you, doctor. Thank you for being with us and giving us a lot of valuable information about ovarian cysts.
Thank you, Jasila. That was a wonderful talk.
Thank you once again. So viewers, I hope this was a very informative episode. Tune in to a new episode of BMC Global Live, Al Hilal Health World, Nothing But Lifestyle, next Tuesday at 8 p.m. Stay happy, stay healthy. This is Jasila Mujib signing off. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.